everyone.
Hi.
I'm gonna present prostate cancer. Before the presentation, I'll tell you the reason why I chose prostate cancer. I'm majoring in health industry, so I took a trial lesson about English for healthcare program at ESC school. Unfortunately, I can't remember the teacher's name, but I was so impressed by her lesson, which was about prostate cancer. Also, the prostate cancer is the most common cancer in Canadian men. That's why I chose it. I'll introduce prostate location, function, cancer, causes, risk factors, symptoms, screening test, and treatment. Prostate is located under the bladder and surrounds the urethra. Prostate produces the fluid that nourishes the sperm. It also provides most of the volume of semen. Prostate cancer begins as a small lump inside the gland. Most prostate cancer grow very slowly and don't cause symptoms for years. Some grow rapidly and metastasize to pelvis, vertebra, ribs, kidneys, and even brain. Pelvis is here, and rib is here. Vertebra is here. Actually, there is no single cause of prostate cancer, but some factors appear to increase the risk of developing it. First one is age, which particularly after 65. It is uncommon in men under 50. Family history of prostate cancer, high levels of testosterone, and African ancestry are risk factors. Also, the effects of diet, especially a high-fat diet, obesity, inactivity, and working with cadmium are being studied. But some men develop prostate cancer without any of these risk factors. The prostate cancer symptoms are divided 5 stages. At first, there are no symptoms for years. In early stage, it's difficult to urinate. Patients need to urinate frequently or urgently even night. It's called nocturia. In more advanced stage, it causes bloody urine and sudden inability to urinate. It's called hematuria. In after metastasis, pain in lower back, hips, thighs, and groin. In metastasis to spinal cord, patients get numbness, weakness, and incontinence. Last one is anemia. They will losing hemoglobin. There are 2 screening tests. All men over the age of 50 years should discuss with their doctor the potential benefits and risk of early detection of prostate cancer using PSA and DRE so that they can make informed decisions about use of these tests. PSA is blood test. It is not totally reliable on its own. If PSA is high, there is no cancer. Sometimes high when there is no cancer, and sometimes lower when cancer is present, but generally high when cancer is present. Another one is DRE. Doctor introduces a finger into a rectum and feels for hard lump in the prostate. If DRE is positive, PSA is normal. You have to believe there's a cancer. But DRE is negative and PSA is high. You will have to believe there isn't a cancer. There are lots of treatments for prostate cancer. Prostate cancer surgery is called a radical prostatectomy. It's an operation to remove the prostate. High energy X-rays are used to destroy cancer cells. In extremal radiation therapy, the rays are carefully aimed at the tumor, avoiding surrounding healthy tissue. In internal radiation therapy, radioactive seeds are placed directly into the prostate. Hormone therapy aims to eliminate or lower the levels of testosterone in their body. To slow the growth of the tumor, some men choose to have their testicle removed surgically instead of taking medication. It's called orchidectomy. Thank you.